Hello, this is Jeff Myers, and this is my Counseling 602 presentation on narrative theory. So narrative theory began in the 1980s by Michael White and David Epstein. They wrote a book called Narrative Means to Therapeutic Ends in 1990. But they also experienced early, and this is Michael White, experienced early success in the late 70s with patients of anorexia nervosa. Michael White was an Australian social worker, and David Epstein, a therapist and the director of the Family Therapy Centre in Auckland, New Zealand. The basic tenets of narrative therapy are that our lives are made up of stories that take place in the context of social, cultural, and political power forces. Social constructionism is what they refer to that as. And problems arrive when a person's lived experience does not match the meaning that they ascribe to the stories in their life. These societal and political forces were very important to White and Epstein as they saw people's problems as deeply influenced by them, and that people were greatly affected by these societal forces. The basic tenets of narrative therapy. The therapy involves creating alternative stories. You could say alternative meanings to the stories that people experience. That clients explore how language is used to perpetuate their problems, meaning the words that we use to keep telling stories, in one sense, continue to create our reality. And clients create new meanings around their narratives, which open them up to new possibilities and hope for a better future. Uh, Counselors help the client see themselves and the problem as separate from each other, and it's a strength-based and future-focused modality. Strength-based in the sense that therapists help clients identify times in their lives where they were not experiencing the problem that they're seeing the therapist for, and they capitalize on what those circumstances were or what those resources were that the client was drawing on at that time when they were not experiencing the problem, so that the client can repeat what was going well and thus create their preferred future. The nature of the counseling relationship, the counselor acts as a consultant to help the client fight against the problem that has attacked their life. They do this beginning with respectful curiosity and then questioning that helps the client to define clearly the problem or the story that they're telling. And then the counselor helps the client develop a new and preferred story. One note here is that therapists must be aware of their own power and authority as professionals in the client counselor relationship, but the client is the expert in their life. The population is best served by narrative therapy. Children with conduct problems, delinquency and bullying, anorexia nervosa, child abuse, marital conflict, adjustment to an AIDS diagnosis, and schizophrenia. Therapeutic process and goals. So the process involves helping the client examine the story they're telling themselves by, first of all, positioning a collaborative position. This is that consultative relationship where the counselor positions themselves collaboratively alongside of the client to help them re-author their story. Next is externalizing the problem. This is a major facet of the process in narrative therapy, where the therapist phrases their questions in such a way that creates distance between the person and the problem. Questions could sound like, when did this problem first appear in your life? As if it was attacking from the outside. What is this problem? Let's say anxiety. What is this anxiety trying to get you to do? Or what form would standing up against your anxiety start to take? Third would be equivocate unique outcomes. And this involves describing times when the client was not distressed by the problem, what was going on that they can recreate. This is the strength-based emphasis coming into play, helping the client describe their preferred identity story. And that could start to sound like with questions such as, what do you think this says about your life, uh, about the life you want for yourself? And what actions will you commit to starting or stopping to build this life? Next, in the therapeutic processes, alternative stories and reauthoring. This is where the therapist helps the client construct counter stories to what is causing the problem in their life. Corey states that a turning point in the therapeutic process happens when the client decides to voice that the alternative story they want to live is they're choosing that alternative story rather than staying stuck in their problem saturated story. And then fifth, documenting the evidence. This is relatively unique to narrative therapy. And this could take forms such as the client writing a personal declaration of their new posture, their new stance, their new story. Or the therapist actually may write a letter to the client using their words to remind and reinforce the work that was done in the session. And these types of things are helpful in narrative therapy because the client can refer back to them again and again and reinforce. Current related neuroscience. One of the techniques in narrative therapy is to name what's going on in the story. And it's been found that naming releases a soothing flood of neurotransmitters as if the body is thanking you for being able to name what the body is feeling. This brings a sense of positive emotion and relief and an opening up to novel thoughts and new insights and a pivotal experience, that shifting from living in the problem saturated story to the new preferred story. And Denborough asks an interesting question in his article that's in the resources. Uh, are these soothing neurotransmitters being released because people are able to name their experience in their own words? Or is it possibly because there's a social value to people being able to name their own experience? Uh, this is one of the issues that's encountered when analyzing neuroscience data on narrative therapy. And just to be clear, the question is it is the soothing release of neurotransmitters happening simply because the person is actually naming their reality, or is it happening because they're living up to a societal norm of being able to speak your mind or tell your story honestly? So that creates an interesting dilemma when it relates to neuroscience. Empirical support, one example, the effectiveness of narrative therapy in a group setting. There was the narrative restructuring or the autobiography modality of writing with a group of alcohol abusers. In that, researchers found that that hopelessness decreased in 80% of the participants in this particular group, and that the problem solving ability increased in 97% of the participants. This group setting emphasizes or is consistent with Cloud and Townsend's emphasis that people are essential for the healing process. And Michael White actually called a narrative therapy a relational and anti-individualistic practice, which underscores when Cloud and Townsend say people are God's plan A for the growth and healing process. Here are references, and thanks for watching.